Prolapse. How does a woman know she has it or is developing it, if that's even the right terminology, and what to do?
So prolapse is when pelvic organ prolapse is when that hammock of muscles is not supporting your pelvic organs as well. It's typically your uterus, your bladder, your rectum, and it starts to kind of push into the vaginal canal, and then you feel something in the vagina. It could feel like heaviness or pressure in the vagina, like something's falling out of the vagina. You're showering and you kind of feel a bulge at the opening, or it feels like rubbing on the inside. So it's not that your bladder's falling out of your vagina, it's that the bladder's kind of pushing into those vaginal walls because those vaginal walls, which is part of the pelvic floor, isn't supporting those organs as they should. Now, I will say the majority of women who walk into a gynecology office will have some degree of prolapse, particularly if you've given birth. So that is not unusual. I think when it becomes an issue is when it starts moving past the vaginal opening, when it's limiting your activity levels, like you can't run, you are uncomfortable during sex, you can't hike or walk or do things in an upright position because you start feeling that discomfort, or you'll experience things like urinary leakage, incomplete emptying with bowel movements. So it's really important to, my tips for prolapse are like stop straining, making sure you're
Yeah.
not pushing when you pee and poop, make sure you're not like overlifting with exercise, and not breathing properly. To strengthen, you've got to kind of support those vaginal walls. I'm also a huge fan of topical estrogen, particularly during perimenopause and postmenopause, which plumps up those vaginal walls. And then you can get support using a pessary, using kind of compression underwear. I have people who wear Spanx just to kind of give yourself a little bit of support while you're strengthening and improving your muscle tone.